and my name is Casey and I'm a physical therapist assistant. We are here to present to you our Move It or Lose It class. So this class has two different circuits. There are 5 exercises in each circuit. The first circuit is going to be a little more strength focused. The second one will be a little more cardio focused. We're going to run through each circuit twice. Each exercise will be working for about 40 seconds, have about a 20-second rest in between. We will have modifications, so we will have a higher intensity, which I will be doing for this workout, a lower intensity, which Casey will be demonstrating. You can kind of float in between depending on your current fitness status, and you can flow as you need to, making sure you keep good form and always focus on that.
Throughout this session, your balance will be challenged, so please have a stable surface near, whether that's a bench, a wall, a chair, anything like that, just in case you need it. Also, if you feel any pain throughout any of the exercises today, please try the modified version or just stop and resume during the next exercise.
Alright, so we are going to start with a warm-up led by Casey Vito.
Alright, we're going to start with upper body. So we're going to do some shoulder circles. Going backwards, you can do small circles, large circles. If you already have a warm-up routine that you do, whether maybe that's through physical therapy that you're in, please feel free to do what feels best for you if that gets you a little bit better warmed up. And switch directions. All right, we're going to go across and back. This is a controlled swing, so try not to use momentum with this. Feel the stretch through the chest as your arms go back. And then shoulder blades should be moving forward as your arms come forward. Switching which arm or hand is on top and bottom. All right, next we're going to warm up the hips. So we're going to be doing a single leg balance on one side. Use your table or bench or chair if you need it. Okay. Make sure that your foot is going just as far back behind the hip joint as it is forward, just like you can see with Erin. She's not just moving her foot in front. So make sure you're getting good hip extension. Switch directions. We're kind of flying through this warm-up. We've done it a couple times. We're shooting multiple videos today, so if you do need a little bit lengthier warm-up, please feel free to do so if you need to pause this and do a little bit more. Good, switch sides.
Also, full disclosure, we totally just ran through all of this and we weren't actually filming.
You're right.
So,
yep.
Full disclosure there.
So we're redoing it, which is
Woo!
fine. It's fine.
We're going to be so warm.
Switch directions. We'll get our workout in for the day, that's for sure.
Yeah.
All right, and then last one. Shoulders are back, chest is forward, your arms are resting on your hands, and you're going to hinge at the hips, shifting your weight back to your heels. Feel the stretch in your hamstrings, the back of your upper thighs, and come up nice and tall. You want to make sure you keep a nice straight spine through this. Try not to round your back at all. Okay, just like Erin's doing. She's keeping those shoulders back, hinging at the hips. Her whole trunk is moving as one. We'll do 2 more. Squeeze your bottom at the top, bring your hips all the way forward. And last one before we get started. All right.
I'm just really, really excited to do these side planks again. I just have to say.
So we will be starting with some side planks. Erin will be doing the higher intense version today. So if you've been working out, you have a routine, you know that you can manage a little bit more difficult exercises. Please try her exercises and modifications out. Otherwise, if you need a lower intensity, feel free to follow along with me. Also, if you have not worked out in a while, start with me. Then as your body gets more comfortable, you can jump to the higher intensity exercise if you feel ready. So, let's get started. Side planks, if you're with Erin, will be on the floor. Okay, let me restart my timer here. Otherwise, be up on a surface if you're with me. Okay, hips, ankles, and shoulders are nice and stacked. I have a straight line from my shoulders to my ankles, and then my chest and shoulders are squared up to the wall that I'm facing. All right, let's get started here. And go. Make sure that your shoulder is over your elbow. Try not to have your elbow too far in towards your side or too far out. This is the most stable position that it's going to be. Seconds.
You'll feel your glute working too in addition to those side abs.
Good job, guys.
Especially if you just did a round of these right before.
All right, go ahead and rotate, switch sides. All right, and go ahead and lift those hips up, hold it. Nice job. If it's too difficult to hold the whole time, and you've already tried the modified version, which is the one up on a surface, then you can rest your hips when you absolutely need to, and then raise back up. But try to do the full 40 seconds. We're 20 seconds in. You're doing great. Make sure you're breathing. With every exercise, continue breathing. Do not hold your breath. We've got 8 seconds left. Nice job. Try not to rotate at all. And very good. Woo. All right, next exercise. We're up on our feet. We're going to do alternating forward lunges. Okay? So, you're going to take a nice long step forward. Go down into a lunge. Okay, Erin will give you a side view so you can see how form looks. And noticing she's bending the back knee as well. She's not keeping it straight. Okay, her knee is not going in front of her toes. She's sitting back. That is wrong. We don't want that.
Yeah.
Sitting back in your front heel. All right. If you need a wall or anything nearby, please go and use that for balance. All right, here we go. To modify this, you can go about halfway to the floor. So maybe do a half lunge, just don't go quite as deep. Okay? We always want quality over quantity, so we would rather have you modify it and do it 100% correctly instead of doing it incorrectly and doing it all the way down to the floor.
Also,
Good job.
you typically need a bigger step than you think you do.
Yep.
So you should not be lunging here.
All right, next we've got our core exercise. So if you have a bench or a chair, that's when you will use this if you're doing the modified version. Okay, so you're going to crunch, bring one leg up, and alternate. Make sure you're actively squeezing your abs. Don't just go through the motion. Okay, if you're with Erin, you're down on the floor, and you're alternating there. And she's lightly tapping her heels. So most of her weight is sitting back in her trunk. She's not keeping a lot of weight on her feet. Okay? All right, here we go. 40 seconds. Try to work your breathing in with it. Try to exhale as you bring one leg up. Inhale as you bring it back down to the starting position.
The farther back you're leaning, the harder it'll be. So if you stay a lot more upright, it's going to be super easy versus if you get a good lean.
If at all throughout this you feel low back pain, adjust yourself a little bit higher. Don't make it quite as difficult. All right, very good. Next we have lateral lunges. So again on these you're going to take a nice wide step out, a little bit wider than what you would think probably is normal here. And you're going to sit back in your heel. Okay, we're going to alternate these again, just like we did with the forward lunges. Now watch Erin's form. As she steps out, her knee is not going in front of her toe. It's kind of just hovering right above it and even sitting back behind it a little bit. She's really sticking her bottom back because that's where we want to lunge with. We want to lunge with our booty, not our knees, okay? So pay attention to where that knee joint lands compared to your toes. All right. And let's do it, 40 seconds. If you're with me and you're modifying it, we're not going to go quite as low, okay? Make sure you're doing it properly, sticking those hips back first, then bending at the knees. You got it. Should really feel this in your bottom, in your glutes. Get a good, strong push back to center. 10 seconds. Good job, guys. Good. All right, last one. We're going to work our upper back muscles, which will help with posture. So if you're with me and we're modifying it, you're going to bend at the hips. So you're going to hinge, sticking your bottom back, keeping your neck nice and neutral. Arms are up, and you're going to squeeze your shoulder blades, okay? Abs are tight to help your low back hold this position. The whole time we're activating those upper back muscles, okay? Yeah, if you're with Erin, you're going to lie on your stomach. This is going to be a more challenging position, increasing the range of motion through your shoulders. And she is pulling those shoulder blades back the whole time, squeezing through the upper back and holding. She's just changing her hand position as she rotates. So thumbs together and around, just like you're doing a sunrise. Woo! All right, let's do 40 seconds. Okay, get in position and go. Make sure if you're modifying it, you're not just bending forward at the hips. You're hinging your bottom back. You're sitting back into your heels, tightening your abdominal muscles. If at all you feel your lower back through this, pain-wise, if you're feeling pain, then go ahead and come up a little bit more if you need to. Otherwise, try to get your trunk as parallel to the floor as you can. 5 seconds. Good, nice job, guys. Grab a quick drink, and we'll do round 2, starting from the top.
Personally, I'm really excited to do more side planks.
Woo! Erin's really excited.
Mm-hmm. In case you couldn't tell, I really love them.
Mm-hmm. All right, so starting from the top, we have our side planks. So if you're doing the modified version with me, we're up on an elevated surface, so I'm going to use this bench here. Okay, shoulders, hips, and ankles are stacked. If you want to bring this top arm up to help keep your shoulders and chest square to the wall, do. Otherwise, I just like to rest it on my hips. All right, we're going 40 seconds. If you're with Erin, you're on the floor, same position, and go. There should be a straight line from your shoulder to your ankles, so you're not bringing this hip up too far, and you're not sagging that hip down, okay? We're holding.
Make sure you're squeezing your glutes too. Some people want to kind of cave.
Mm-hmm.
Squeeze it.
Yep, your hips are forward nice and flat. There should be no bend at the hips. We've got 10 seconds. Finish strong. And good. Switch sides. Go ahead and rotate or turn, whichever way you want to do that. This way. All right, and up. Right underneath, Erin.
Woo! So I cannot drop.
Don't drop. So if you do like these workouts and you are free during the day, we have them at the Colfax Library once everything gets back to normal. On Mondays and Wednesdays from 11 till noon. Call the Whitman Hospital Physical Therapy and Occupational Therapy Clinic. Well, speech is there too. If you need further information. 3, 2, 1, and rest. Very good. All right, next we're on our feet. We've got our forward alternating lunges. heel. Not allowing that front knee to come in front of your toes. Keep it behind your toes. Nice job, guys. Seconds. Get a nice strong push backwards. Last one. Good. All right, we've got our core exercise next. If you're doing the modified version, we're up on a chair or a bench. Okay, bringing one leg up towards our trunk and squeezing. If you're with Erin, she's doing it from the floor. Her trunk is seated back a little bit further. Just like that. All right, 40 seconds, let's do it. Again, if you have any low back pain through this, come up a little bit higher. Try not to decline yourself quite as much and really pull through your core, okay? Squeeze those abs. We're halfway there.
And your hands aren't really like pushing you up. Don't cheat yourself. I mean, it was tempting, but don't.
6 seconds. Good. All right, we've got our lateral lunges next. Make sure you have room to the side of you. Nice wide step out to the side. And you're sitting back in your heel, driving your bottom back, using those glute muscles, not the knee. All right, and go. Again, same movement for both versions here. I'm just not going quite as low. You're doing advanced with Erin. She's going nice and low. Trying to get that knee angle to 90 degrees. Nice job, guys. Go at the speed that you feel is comfortable for you to maintain good form.
Can assume the prayer position, like Casey and I both have. You know, just trying to make it through.
All right, and then last one. Yep, Erin is down on the floor. Okay, arms are up, so her arms are not touching the floor the whole time. She's squeezing her upper back, moving those shoulder blades as she does it. Okay, if you're with me, we're bent. Try not to just go through the motion on this exercise. Really feel those shoulder blades squeeze together. Okay. We've got 15 seconds left. If you're with me, make sure you're squeezing your abdominals, helping your lower back out to support you hinging. 3 seconds. And very good. Grab a quick drink. Catch your breath. We've got our cardio circuit next. Woo! Get those heart rates up. Okay. We hope you are all enjoying this workout thus far. Maybe give you some accountability to get your workout in. Okay, so the first exercise, I just looked at it.
High knees.
That's it. No, ice skaters.
No, high knees.
Oh, hey. Okay, we're doing high knees. So if you're with me, okay, that was with me. So if you're with me, do that. If you're with Erin, just do high knees. Bring your knees up, use your arms, you're adding a little hop into it. If you're with me doing the modified or low intensity one, we can do a march, okay? Or you can still do it with a hop, little jump, but don't bring your knees quite as high, okay? All right, 40 seconds. Whew, let's do it. And go. I'm gonna do the in-between. If you need to do the knee taps, please do. Try not to rotate. Okay, you're just bringing your knees straight up going. We're going to do ice skaters. So if you're with me, you're tapping to help with the balance. Touching that back leg. If you're with Erin, you're adding a hop into it just to one leg. So you're not balancing and touching that foot back like you are with me. Go. Perfect timing. Woo.
Couldn't have done that better if we tried.
And notice we're never coming to a full stand. We're staying low. Our hips are staying about the same level throughout the whole movement. Chest is forward, hips are back. Nice job. 15 seconds left. Short and stopping here. Okay? If you're with Erin, you're on the floor, trying to reach those laces as you bring your hips up. Okay? All right.
And your feet should be apart. Don't have them close together.
All right. And it's not going to ding because it already dinged. So we've got 38 seconds left. And go. Got it, guys. Feel your abs engage as you rock forward, bringing your hips all the way forward, but don't come so far forward that your lower back dips down too far. 15 seconds left. 5 seconds. And we're going to walk, I'm doing the modified. So we're going to walk in, okay, 4 steps, and then we're going to walk out 1 big step, okay? 1, 2, 3, 4, 1 big step, okay? If you're with Erin, you're going to be hopping, okay? As she's hopping all the way out, she's doing it in a controlled fashion. She's not letting her hips sag too far down.
None of that.
Yes. Keeping her core nice and tight. Alrighty. Let's do it. Go. Try to keep your shoulders over your wrists. You got it, guys. Probably feeling those shoulders burn a little bit.
If you're with me and you're trying to do the advance but you can't control the hop out, you can hop in and step back if you need to.
10 seconds. We've got 1 more exercise after this, guys. Good. All right, we're up on our feet. Last one we're finishing with squat jumps, okay? So, you are getting your feet nice and wide, about shoulder width. You're going down into a good squat, sinking back in your heels, okay? And then you're coming up, adding a little hop. If you're with me, we're just gonna drive up to our toes, bring our hips forward. If you're with Erin, you're adding a hop. Woo! Have fun with that.
I will have a blast, Casey.
If you want kind of that middle ground, you can do a hop. Just try to stay close to the ground, okay?
But notice, no matter which one she did, she continuously moved. So you don't hop and then go into it and stop. And you don't do here and stop. She's always moving in and out of that squat.
Yep. All right. Last one here. You got it, guys. Finish strong. And go. workouts you are sore, like tomorrow or the day after, that's okay. Soreness is okay. Now if you're sore like 5 days later, you probably overdid it a little bit. But don't just sit the next day if you're sore. Go for a walk, try to work that soreness out, drink lots of water, especially since the weather is getting nicer. Take advantage of the sun, get some vitamin D. All right, last round. We are going to start with high knees, okay? So if you're with Erin, really driving those knees up, arms up, okay? If you're with me, we're either doing the touches, knee taps, or the low jog, okay? All right, last round, you got it. Push yourself here, 40 seconds, go. You got it, get that heart rate up. It's already up.
Oh,
Keep
it's
it
up.
there.
It's up.
Keep it there. All right, I'm going to switch it up here. Almost there, almost there.
10 seconds. Try to pick it up.
Use your arms. Don't forget about those arms. All right, next we have our ice skaters. If you're with me, we're bringing that back foot back and touching to help stabilize, help with your balance. Okay, if you're with Erin, you don't get that foot behind. You're just doing one leg. Single leg balance there. We'll start in 3 seconds. And go. Try to stay low. You're never coming to a full stand. Oh, that's right, I got my foot back. Try to keep your hips about the same level, your shoulders about the same level the whole time. Your bottom is back, chest is a little bit forward.
You're over halfway.
To make it a little bit easier, you could take a smaller step. To make it more difficult, take a wider step. 3 seconds. All right, next we have our plank shoe touches or lace touches or knee touches, whatever you want to go with. You're with Erin, you're on the floor. She's reaching all the way across to her laces. Okay, hiking her hips up. And then make sure as you come back down, you're bringing your hips all the way forward, engaging those abs. And go. If you're with me, we're doing it from an elevated surface. Okay.
Gotta have good control here, guys. Last half. Make sure when you rock forward into that plank position, your shoulders should sit right above your wrists. Okay. 5 seconds. And good. Rest out of that position for a second if you need. Next we have our plank ladder. So if you're with me, we're stepping. 1, 2, 3, 4, forward. 1, 2, back. If you're with Erin, you are jumping. 2 jumps forward, 1 jump out. If that's too difficult, you can step out. Go. You got it, guys. Last round. Push yourself. Make sure that your form stays good. Last half. Listen to your body on this, guys. 10 seconds. We've got one more exercise after this. Come up to your feet. We have squat jumps. Last one. If you're with me, we're not going quite as low. Okay, and we're not adding the hop into it. So we're just doing a reach, driving through our toes. If you're with Erin, you're doing the jump. I'm not doing it early. And go.
And go. If you want, one that falls in between these two, just add a tiny jump. Okay?
If you've been doing advanced and you don't really feel your calves anymore, that's fine.
That's normal.
I don't know that I have calves anymore, honestly.
You got it. Push through. Don't stop. Don't stop.
Less than 10.
Almost there. Don't stop early. Good form. Woo! Air high five.
Yeah. Air high five.
All right, nice job, guys. Catch your breath. Grab a drink. We'll do a quick cool down.
Bottom. If you can't, you can get into a little lunge, tucking your hips forward.
Should feel it right through the front, kind of right near your hip flexors. Good. Go ahead and switch sides. Feel a stretch through your hamstrings, keeping a nice flat back. Good. Come up, go ahead and switch legs. Make sure you're not stretching into pain. None of these stretches should be painful. You should feel a deep stretch, maybe some slight discomfort just because those muscles are tight, but you shouldn't feel pain. Cross one leg over, let the knee fall out, fold at the hips. You should feel a stretch kind of through your butt. Good, come up and switch. Good. All right, you're going to bring one arm across your body. Use the other arm to loop underneath and increase the stretch. If you already are a part of our Move It or Lose It class at the library, we miss you all. Yes, very much. We miss you dearly. We can't wait to be back. Yes, we hope you are all staying safe and healthy. Can't wait to see how super strong you're getting in this off time. Just working out every day, right? Good. Relax, bring one arm up, let it fall back. But really, especially since the weather is nice, make sure you're going on walks, you're getting time outside, you're staying active. Good. Swing and switch. Just because you are stuck inside, or, well, not necessarily stuck inside, stuck within the confines of your home